Hello, you're watching The Wellness Hour, the leader in medical news and information. I'm Dr. Bill Dorfman, sitting in for Randy Alvarez today. Now, you may recognize me from ABC's Extreme Makeover as a featured dentist, but we're not talking about dentistry today. Today we're going to talk about cosmetic dermatology. And with me here is Dr. Simon Ourian. Dr. Ourian has invented the Coolaser, and based on utilization of manufacturers, he does perhaps more Botox and fillers than any other physician in the world. Not only is Dr. Ourian a great doctor, he's also a great friend of mine, a colleague, and we have a lot of really interesting things to talk about today. So without further ado, I'd like to say hello to Dr. Ourian.
Hello, Bill. Very nice to meet you. Thank you to see you again. Thank you
Now,
so much.
I've been in your practice, Simon, and I gotta say, I've never seen an office run like yours. I mean, not only is it one of the busiest, but you guys are so efficient and so great at what you do. And I love just even sitting in your waiting room and seeing the hundreds of before and after pictures. So tell me what it is that makes your practice so unique and so special.
But when we first started to have our practice, it started from a very small practice, one room in another doctor's office. And my number one goal from the beginning was to have an office that would be similar to a hotel, for a 5-star hotel, that patients could come in, have a great experience, have little intimidation, they could ask any question they want and get really good down-to-earth answers and solid answers that they could walk out with the information and make good decisions. This resonated with a lot of people, and starting from a few years ago, our practice kept getting bigger and bigger, and we are now one of the largest practices in the world, and we still stay true to our first original thought.
I actually met you first as a patient because one of my patients had told me about you, and the problem I had is I had such a thick beard that every time I would shave, especially on my neck, I would just I looked like I was hemorrhaging. So you removed all the hair on my neck. In fact, you have a case here. Why don't you show our viewers what you brought?
Bill, although I don't have your picture, but what as you remember, it was the picture that this
yeah,
was similar
and look
to
at all
neck.
those red sores. Every time I shaved, it would just be, I get blood on my shirt. I hated it.
And within a few sessions, we got rid of the hair, the unwanted hair. So you still can shave if you wanted to have some hair, you could keep it. But what it did for you was that you could shave and without having to worry about the ingrown hairs, the problems you had.
It was amazing. In fact, we went from the neck all the way down to the ankles, and we'll talk about that in the middle. But you know, your second picture here is not me. Okay, this is not my back. But what happened
this is a regular patient who actually comes to our office to do hair removal for the back, and a lot of people walk around thinking, what can I do for my hair on my back and on my body? Although this is a very extreme case, but the truth is a lot of people have a lot of ingrown hairs and unwanted hair on their body, and they wax, they shave, they do everything from electrolysis. All of these things are either temporary or painful. Laser hair removal was quick, easy, and the results are lasting and in many cases permanent.
Yeah, no, let me tell you something. I mean, I got to do some photos for Men's Health magazine. Now, I wasn't real hairy, but you know, I had some hair on my chest, so I went and I got it waxed. You know, that was horrible. I remember the scene from 40-Year-Old Virgin. I mean, I had my daughter by me. I'm like, oh, this will be nice. They pulled that thing out. I was like, ah!
I had hair on my neck, and I remember the very first time I did wax on my neck because somebody told me this is a great idea. It is not a great idea. It was painful, and for men are not used to this much pain.
Horrible.
And I had the worst experience. And until I discovered this laser hair removal, it was the best thing that I could ever do for myself and for my patients. Over the past 10 years, we have done more laser hair removal than practically any other single office in the country.
That alone, it is one of the greatest things. And for women, I know they get their arms, their legs, their underarms. They never have to shave again. But that's not the biggest part of your practice.
No, but that was the launching pad for our practice. It actually brought a lot of people who weren't looking to do any kind of a invasive procedure, and I always wanted in my life to do something that could make people's lives a lot better. And in the past 10 years, the new technology that became available, and I was there in the beginning, and I was there in the middle, and I have been there to make it better and make it more, improve it, and so that people can use it.
But you know, you said something really great, non-invasive. What I found is that the things you do in your office are really so minimally invasive, but so dramatic. I mean, show us some of the stuff you love to do, Simon, because I know you do some really amazing things.
One of the things that I tell patients, and I tell all my friends, I see people, this is one of the best subjects people like to talk about. Who doesn't want to look better? Everybody wants to look better, but the problem is we don't want to have a major surgery, we don't want to look artificial, we don't want to look unnatural. Luckily, in the past 10 years, we have had so many great results. We have had so many new breakthroughs because the baby boomers are driving the market and they demand procedures to be done, and the market has responded.
Let me tell you something. You know, I'm going to be 50 in September. You know, if you can turn 50 and look like you're in your 30s or 40s still, that's a great thing. So I'm all for everything. It is one step beyond getting your hair cut. Nowadays, it is such a simple procedure. If you go to the right doctor, if you go to the right place, you get these procedures done right. It is a simple procedure. These are safe procedures. These are predictable and very effective procedures. So, and you know what? You said something really important too. Looking natural. You know, I have so many of these women that come into my office, they look like Daffy Duck. I mean, you have never done that to a single patient I refer to you. You know, if you do fillers in their lip or whatever it is, it always is subtle, it always looks natural, and I think they always look better where, you know, sometimes they come in and honestly, I look at them and I say, oh my God, what happened?
Bill, this is every time I see a patient, as soon as they sit in my chair, I feel like they are going to be the product of my work. And they can go out and they tell their friends how they ended up looking. Even if they ask me to give them those Daffy Duck lips or the Hollywood lips, I'm never going to do that. I want them to look natural. I want people to look their absolute best. And I want them to go home and their friends say, you know what, you look better, but you can't exactly tell why they look better. They look more rested, more natural, more youthful.
I agree.
So some of the things that we start from, if you're in your 30s and 40s and you start to look a little bit not like the way you did when you were 20s, the gateway to looking better, it starts with Botox or some of the dermal fillers, which are easy and they're reversible. If you don't like them, 2-3 months later, they can go back. Some of the pictures that I have brought are from Botox. For example, this is a patient who had when he would smile, he would have all these smile lines, but then with the Botox, a few days later, all the lines are gone.
Why don't you explain how Botox works? I mean, it's hard for me to believe because I'm like in the thick of it that people wouldn't know, but there are probably people out there that really don't understand how safe and effective Botox is.
It still amazes me that I walk into people and they tell me about Botox. They say, well, I heard Botox paralyzes you or it's a poison.
Oh, it's poison. Yeah, right.
And you're going to kill. If this was true, half the people in the country would be dead by now.
Right,
At least in Beverly Hills, you wouldn't have anybody walking around.
Everybody in Beverly Hills.
But the truth of the matter is, Botox is like a flu vaccine that you get a little bit of a piece of the bug and you inject it and it doesn't make you sick. However, it does make your body work with it. Botox is not going to make you sick. All it does is that puts a block between your muscles and your nerves. So the nerves are still working, the muscles still working, but there's a miscommunication between the two of them, so you don't continue to make those facial expressions that you want. And if it is done right by a doctor who has done this for many years, you are not going to look artificial or you're not going to lose your facial expressions. It amazes me that still I see patients who get Botox and they look like they are masked. This is not a right way of doing Botox.
No.
If you can recognize someone who has done Botox from a distance, that's one that has not been done right. The right way of doing cosmetic procedures is to do it right, natural, and in a way that nobody can tell you've done something. You just look a lot healthier. You just look more rested.
Laser hair removal, Botox. I mean, those are things that most people will really understand. But some of the really radical changes that we're getting today are with fillers. So maybe you could tell our viewers a little bit about the fillers and how they work.
Well, one of the most important things that happen during the aging process as we get over the 20s and 30s is that we lose a lot of the subdermal fat, the fat that you have underneath your skin, that goes away. You also get a little bit more sagging and you get fine lines and wrinkles due to sun damage. If you can change all these things step by step by doing little things, not really a major dramatic surgery, you look like yourself the way you did 5 years, 10 years ago. So you don't need to get a surgery, you don't need to cut, you can do little things and still go back to the way you did. One of the most amazing results we get, with dramatic results that we get, is dermal fillers. Dermal fillers can be short lasting, something like collagen or Restylane that lasts anywhere from 3 to 6 months. all the way up to permanent, such as artificial or radiance, which lasts for a long, long time. These procedures are, I can show you some of the pictures of these treatments. A person who comes into my office has lines around the mouth, the lips have shrunken over the years, the sun damage, the lines have become a lot more, and over the years we just basically have become sunken. All we need to do is to go back and add volume to this. Once you add a little bit of volume, your face goes back to the way it was before.
So show me on this picture where you're actually adding the volume.
This person had lines around the mouth and had lines around the lips, and you can see as we added the volume, it is the same person still.
And all those little lines above her lip disappear.
Are gone, and the lips are still looking the same as they did 5-10 years ago.
And this takes what, like 5 minutes?
Really, literally 15 minutes. I take a lot of time because I want to make sure everything looks good. So most of my time is looking at it from 50 different angles, and that's where the art and the science of it come in place. But because of I have had experience with this, I now see how it's going to look and what's going to look natural without making it look like you've been overinflated.
Right. And you know, one of the things about this, I'm one of these people, like, if a little's good, I always think a lot is better. You know, if you're going to do this procedure, you can kind of do a little bit and you can come back and add more, right?
Exactly. Because it's reversible, it's predictable, you can add on to it whenever you want. It's better to do it slowly. I have a very gradual process to it, and I tell patients, go take a look at it, have your friends, your husband take a look at it, and if you don't like it, you can come back. We can either reduce it, we can add to it. I always want to add to it, which makes it a lot better. And 9 out of 10 times people come back and say, you know what, this 80% was much better than I thought, so I'm okay. But if they want a little bit more, we communicate, we can add a little bit more to make the patient look their absolute best. Let me show you another patient.
Hold that thought for 1 second. We're going to cut to a break, okay? We'll be back in just a minute. I'm Dr. Bill Dorfman, standing in for Randy Alvarez on the Wellness Hour. We'll be right back.
It peels the years back. And I had a little bit of puffiness around my eyes. Everything is gone.
It just takes years off your face.
People stop me on the street and go, your skin is so beautiful.
Look better, younger, refreshed, and healthy. No facelift required. In less than 1 hour, the Coolaser can turn back the hands of time.
That brings out your healthy skin back to the way it was supposed to be. Coolaser is the ideal treatment for removal of freckles, discolorations, sun damage, fine lines, deep lines, and it's great to tighten the skin.
Dr. Simon Ourian runs one of the busiest medical practices in Beverly Hills. His experience and expertise with laser technology produce incredible results with minimal risk. The process is fast and simple. First, a numbing cream is applied to the target area. Then Dr. Ourian focuses a state-of-the-art laser on scars, wrinkles, birthmarks, dark circles, or age spots to minimize their appearance.
The advantage of the Coolaser is that it's so effective and so precise, and we can get very close to the areas that we want to and avoid the healthy skin in the areas that we want to avoid.
I went home, it felt a little bit like a sunburn for a few days, and applied some ointment to my face, applied some cool towels to my face, and then pretty much in about 4 or 5 days it was over. And my skin was pink, and I started seeing this newer, healthier skin come to the surface.
I wanted to look how I felt. I felt that I was looking in the mirror, looking more tired than I really was. Within 3 or 4 days after the procedure, I just saw the well-rested me.
Patients with all skin types swear by the long-lasting results of the Coolaser treatments they received at Epione.
Now, with the Coolaser, I can treat people of all skin types, all skin colors, and the recovery time is a lot shorter. Most people can go back to work within a few days.
In the past, skin rejuvenation options were more invasive, required anesthesia, and weeks or months of recovery.
They really made me feel comfortable and really just gave me the confidence that this is the place I would like to be, to have this done.
Patients receive the treatments in the spa-like atmosphere of Epione in Beverly Hills. The experienced and talented staff make the consultation process and the procedure feel relaxing and even luxurious.
The atmosphere, the environment is very relaxing, and I love the fact that they are concerned about you. And they tell you how to take care of your skin step by step.
Even if you've never heard of Coolaser and you may not know what questions to ask, the consultant can actually give you information so that you can make an educated decision.
Patients who have benefited from a Coolaser treatment say it's changed not only their makeup routine and skincare regimen, but the way they feel about themselves.
I don't have to wear base every day or powder every day. You know, my skin, as long as I put sunscreen on, it just looks flawless.
The absolute best part about having the treatment was, in fact, not necessarily the outward change, although those were dramatic beyond my expectations. The more dramatic result was the way I felt about myself afterwards. It was an enormous change.
What I really love especially is when I catch my reflection in something and I just love the way I look. That's a great feeling. So it makes me feel great, makes me feel younger. When I hit 50, I thought, you know, it's time to do something. And it was just a great idea.
I want to age gracefully, sort of, with a little help from the doctors.
We're back with Dr. Simon Ourian. Dr. Ourian is a cosmetic dermatologist in the Beverly Hills area. And the thing I love most about Dr. Ourian's practice is that they don't make these radical artificial changes. If you're starting to get signs of aging, if you're, like me, reaching middle age, 50 years is kind of scary, there are small, subtle things that you could do, like Botox and collagen and Restylane, and procedures that take literally 10 to 15 minutes in the office that will just keep you looking young and healthy and vibrant. Dr. Ourian's going to show us a few more cases. Dr. Ourian, what do you have for us here?
One of the things I want to tell people, and I tell all my patients, that you really you want to do step-by-step matters, and I give you a menu of things you can do, and based on that menu, you can choose A, B, C, or D, or the things that you want to do. Another person I want to show you is a person who had a lot of these lines, but she also had sun damage. So we have to address both issues, remove the lines and also remove the sun damage. The sun damage is removed by the Coolaser.
Now you're an inventor of
Yes.
the Coolaser.
Yes.
How did you invent a Coolaser?
It came. I have a lot of extra time in my hand. What happened was
I know that's not true.
What happened was I was very frustrated with the older lasers that were in the market. I could not use them for Asian skin. I could not use them for Mediterranean skin.
Why?
The older lasers, the CO2 and the erbium lasers, were great. They delivered great results, but they had high intensity, so they would have great side effects. People who have a little bit of a melanin in their skin, a little bit of pigment in their skin, would end up looking either shiny or done or worse yet.
African American patients could never be treated
I could never treat an African American patient, an Asian patient, a Mediterranean patient. We're living in Southern California. That's 90% of our patient population. So patients
probably me too.
No, I wouldn't be able to treat you or your mother or anybody else or anybody in your family. So I would frustrate. I would tell them, I'm sorry, we can't treat you. And so I started working with the manufacturers of the lasers, and I said I needed to make certain changes in these lasers. We made the long story short, it took 3 years, 4 years to develop these lasers, but what happened was that it was a gentler, more effective laser in many cases, and that I could use on all skin types. The results are very effective, just as effective as the older erbium or CO2 lasers, without the downtime that they used to have, without the anesthesia.
You know what? I remember when you did it because it was right in the middle of the treatments I was having to take the hair off my chest, and I came in one day after being at the beach, and you guys sent me home and said, you're too dark.
Yes,
we can't do it.
We couldn't do any kind of lasers on people who had a little bit of skin color to them. So that just basically would be only Caucasian blue-eyed people. Not only that, the older lasers would have great side effects, downtimes, redness for months and months at a time. Who wants to do that? Nobody. I couldn't recommend it to anyone. So the Coolaser, the advantages are it is effective, just as effective as the other lasers before. The results are great. They're predictable. I can dial it to your skin tone, to your skin color. Coolaser is one of the most effective treatments I have found to treat sun damage, fine lines, to shrink that skin and really tighten it up to a natural level, not to a pooled level that some of the old facelifts would look like. The results are very natural looking, and you can go back to work within a few days without the downtime and without the anesthesia. So it makes it the ideal treatment to get that youthful appearance that you want without all the side effects that.
So speaking of facelifts, one of the things that I think is so amazing are these kind of mini 1-hour facelifts that you've been doing in your office. Can you show us a few of those?
Yeah, sure. Well, the 1-hour facelift is by far the most popular procedure we do in our office. Patients come in within 1 hour. I can reverse the years of sun damage. This patient, you can see that there's a lot of sun damage on the face. The lines are appear on this side, and within a few days, the sun damage is gone. There's very minimal downtime. The lines are removed, and we can fill in the areas that have been sunken.
So what do you do?
It's a brand new person. You can remove the Coolaser remove some of the sun damage.
Right.
You see that the eyes become a lot more wider open. The sun damage is gone. The lines are less noticeable, and you can see the tightening of the whole face. It's like the same person, but 5 years, 10 years younger.
So what do you use? You use the Coolaser.
I like to use Dermal filler. I like to use the Dermal filler Radiance or Artifill because they last longer. They're like 4 or 5 years. But frankly, as much as my patients love to see me, I'm sure they don't love to get injection in their face. So they like to come maybe once every 4 or 5 years, get the treatments done, and never see me again, maybe except in a party. So Radiance lasts many years. Coolaser lasts 3 to 5 years, maybe sometimes even more. It even amazes me. I say 3 to 5 years, but what happens is that if you took your sister and another sister and I did the treatment on one of them and none of the other one, the one who received the Coolaser, even 20 years from now, would still look better than the one who didn't receive the treatment. What you are doing is you're reversing the sun damage and you're reversing the aging process, and you give them a fresh start. And that's what the miracle of all these new treatments are.
So what's your favorite thing to do? Because, I mean, I know, like, for me, I love doing veneers. I love doing whitening. What's the thing that you really take your most, like, pride and joy in?
The 1-hour facelift, because of the fact that when patients come in, they don't expect to get much result because they think, what could I get from 1 hour? The truth of the matter is that with 1 hour or maybe a little bit longer, I can give them, without any surgery, without cutting, I can give them, remove the sun damage, we remove the aging process, and give them so many years back that they look so much better than they did before. Some of the examples that I could show you of similar treatments to
this looks like the mother of this.
This is exactly
that's
similar.
Amazing.
This is exactly similar to doing the laser treatment on the face.
That's amazing.
To remove the sun damage, and then going back and filling up in the areas that the person had lost a lot of sun damage.
So how did you get rid of all these lines?
The lines are basically nothing more than redundant skin over the dead layers of the skin, which are basically you get them because of the sun damage that you get. Now, these sun damages, you keep getting them because of the fact that you had lay in the sun. We all love to lay in the sun, and you start getting these wrinkles, and the Coolaser can completely remove these sun damages over the years, and by using some fillers such as Radiance or other fillers, we can just add volume. People also get a little bit of sagging. I can inject some mesotherapy, which melts the fat underneath and gets rid of the sagging. So overall, we do all this custom treatment for a patient to look a lot younger within a few hours.
So let's say, you know, I'm 49, I'm going to be 50, I'm looking in the mirror and saying, you know, I don't think I look as good as I could. I mean, what do? I just come in and schedule a consultation, or you'll just sit and tell me all the things you could do?
Bill, I can give you a menu of the things you can do, and I give you a priority of what I think will help you the most. You look at yourself in the mirror and you think you look not the same, but because of so many years and so much practice and experience that I have, I can look at you and I tell you what is the thing that you can do that you're going to get the biggest bang for your time and for your effort and your buck.
Dr. Ourian, I know that Epione is one of the largest cosmetic dermatology centers in the world, and you guys have a plethora of treatments that we haven't even discussed, but I know there's one that you're really proud of. Can you share that with us?
It is the laser stretch mark removal. This really was the one that came out of nowhere. As I was doing scar revision, I noticed that the stretch marks were going away. As far as I know, we're the only center that does this, and we do it successfully. We have patients who come from Japan, India, Europe, all corners
well, you know
of the
why?
world who come to
because they're having babies in all those countries.
Exactly. This is if you have stretch marks, there's really no treatment out there. I don't care how many potions and lotions you put on your body; they are not going to go away unless you do it with Cool Beam, which is this laser treatment that removes it.
Sure.
Some of the, although this is a patient who has had stretch marks, and she was really very, very stressed. You really could not do much for her except for either do a tummy tuck or a surgery. Even with tummy tuck, I'm not against surgery. I have some of my best friends are plastic surgeons, but there are certain things you really cannot fix with plastic surgery. And stretch marks one of them. If it's right all over your body, what are you going to do? Remove all your skin? This laser really, really works. It, in many cases, completely removes the stretch mark, and in most cases, at least it makes it so much better that the people feel a lot more comfortable with their body.
Dr. Ourian, that was really fascinating. Not only are you an amazing physician, I know you're Harvard trained, you're brilliant, but you're also a really compassionate, nice person. And that really comes across as a patient. Thank you. For viewers out there that want more information, you could go to Dr. Ourian's website, call his office. They offer free consultations for cosmetic dermatology, and I couldn't give a higher endorsement to anybody. Thank you for joining us with the Wellness Hour.